Hi, I'm Bob Darty. At Bank of America, we believe that every citizen should be informed about the important issues affecting their lives and their communities. That's why we're proud to support the CAUCUS Educational Corporation and its production of One-on-One with Steve Adubato at the Newark Museum, a groundbreaking series that will feature some of the very best artistic talent that New Jersey has to offer. We hope you enjoy the series.
Funding for this special edition of One-on-One with Steve Adubato at Newark Museum has been provided by Bank of America. Life's better when we're connected. PSE&G, committed to improving New Jersey's economy and strengthening its communities. Horizon Blue Cross Blue Shield of New Jersey. The Fidelco Group. Johnson & Johnson. Prudential Financial's Global Communications Department. And by Barnabas Health. Life is better healthy. Promotional support provided by NJ.com. Small news, big news, true Jersey. And by the New Jersey Business and Industry Association.
This is One-on-One. I'm an equal American just like you are.
The jobs of tomorrow are not the jobs of yesterday.
Look at this.
You
got this?
Here it is, man. Look at that.
Life without dance is boring.
When you first heard that they were doing Charlie Rose and Gayle King, didn't you go, what?
Do you enjoy talking politics?
No.
People call me because they feel nobody's paying attention.
Our culture, I don't think, has ever been tested the way it's being tested right now.
That's a good question. High five.
Welcome to One-on-One here at the beautiful Newark Museum. It's a series of interviews with some impressive and important, interesting people. Let me introduce Mansa Mussa, who is an artist and art educator right here based at the Newark Museum.
Yes, I am.
By the way, when did you get into art?
I never got into it. When I was conceived, I was an artist. I never became an artist. I was always an artist.
Come on.
I don't ever remember a time in my life when I wasn't an artist or making art.
As a little kid?
As a little kid,
Growing
the
up
legend.
Where, Patterson?
No, born in Patterson, but lived in Newark since I was 2. But I don't ever remember not making art. And in my family, the legend goes, when I was 2, I could draw with a pencil in a brown paper bag.
So the thing is, you have to be in art.
Yes.
You had no choice.
No choice.
It was chosen for you.
Yes.
How about teaching? Was that part of the plan, whether you like it or not? You have to teach.
Yes, because I'm a natural teacher. I naturally tell people what I know. Having something and a skill doesn't mean a whole lot to me unless you can give it to someone else. Because when you teach, you learn. I love to teach because I love to learn.
So why don't you describe the kind of teaching you do here at the museum?
Well, I've been teaching here for 27 years. I started out in the arts workshop. A friend of mine, Mark Morse, was teaching a hat-making class. He passed. And Betsy Roble, who's the manager of the arts workshop, saw me. I took some pictures for her, and I sent them to her. She saw some of the bags that I made, so when Mark couldn't do the workshop he was planning to do the next year, she asked me to do a bag-making workshop. And that's how I started working here at the museum.
So let me ask you something about that. I mean, we've met some extraordinary people here at the museum who are artists, who teach, who make a difference in the lives of so many people. For you, what's it like to interact, particularly with inner city young people who may not see themselves as artists, who may not have had the gift that you had growing up as young as you were, and the light bulb goes off and they realize they can do this?
Well, here at the museum, one of the programs I work in is the Artist in Residence program.
Artist in Residence.
Artist in Residence, where I go into the public schools for 9 weeks. I teach children, and then they have a show here at the museum.
Their work is shown.
The work is shown. My first experience in this building was when I was 17, when Nettie Thomas, my high school teacher at Weequahic High School, put my work in the Mayor's Teen Arts Festival.
What was that like?
That was a life-changing experience.
How so?
Because I created a painting about things that were happening in the community, and a mother was standing in front of my painting, holding her daughter's hand, talking about what was in the painting, what I put in the painting, and things that I didn't put in the painting.
Did you hear her?
I heard her. I still do that. I listen. I eavesdrop. I'm Steve. I'm going to tell you the truth. I still, to this day, I stand behind people when they're looking at my work. I did it that first time that I was in a show. That changed my life. I understood that this talent I had also had this innate power that I didn't know about. So when kids come here and they exhibit their work, I tell them my experience, that it changed my life, being in this building with people viewing my work and listening to what they had to say about it. And if you're a kid from this town and you're a kid from this town, that's a game changer.
Say why.
Why? Because you understand the possibilities in your life, okay? That experience changed my life because I understood that I had a power. If you can draw, you have power. But at that point, I said, maybe I can do this as a career. Maybe I can make a living doing this. And that's what I try to encourage children. Not only that you can make a living at art, but find something you love.
Passion.
Passion. Learn to do it well, and you're going to get up every day of your life, and it's going to be a joy.
It's so interesting, you know, art education in places, in different communities, and I'm not, you know, disparaging any community, but a community of affluence, just a few miles away from here, whether it's Milburn or Livingston, and more power to you, or in my hometown of Montclair, there's a few more dollars, let's just say.
Yeah.
We sometimes don't appreciate what it's like for a young person here in the city of Newark to have the opportunity to be involved in arts education. It's a big deal.
It is. It's a big deal. But, you know, when I teach, it's not just about creating art. Sometimes you talk to kids and you're making art with them. They say, Mr. M, it's not perfect. It's not perfect, but it's wonderful. I said, the important thing is that you're doing your best. Okay?
That's
the most important. It is. It's a self-esteem builder.
Sorry for interrupting. Is working on art here at the museum and you working with these kids, is it building self-esteem? Is that really what it's about?
Sure.
Having them believe in themselves?
Yes, because you look at art and people look at art and say it's beautiful. Well, when the kid starts doing the art, there's nothing there. They have to think critically and they have to learn how to solve problems. They have to take a technique and take this blank thing and make something happen. And make something happen that's going to create a genuine reaction in themselves. And you're hoping it's going to create a genuine reaction in somebody else, just like that painting did for me when I was here at the museum when I was 17. It created a reaction.
And you'll never forget that moment?
Never, not for the rest of my life.
Before I let you out of here, I'm curious about two things. One, funding for the museum is always challenging, isn't it?
Yes.
And those programs are always at risk, aren't they?
Yes.
How does that make you feel?
Makes me feel like I should work harder. Makes me feel like I should talk to more people. It makes me think about my experiences here and the thousands, literally thousands of children, teens, and adults that I've taught here, and wondering if I hadn't inspired them just a little bit, would that have made a difference in their lives? And if you can keep this going for 27 more years, hey, how many lives will you touch? And that'll be a difference maker for them.
Do you worry what would happen if the opportunity were not here for them?
Yes.
You do?
Yes, I do. I mean, there's so many programs that I worked in here, the Junior Museum, Outreach Photography, they're not here anymore.
A lot of the programs are not here.
A lot of the program is not here
because
anymore.
of, clearly, finances.
Because of finances.
Tough decisions that have to be made.
Yes.
One more quickie. I'm a student of leadership. The greatest lesson you've learned about being a leader is?
The best leaders are good followers. The best leaders are good followers. You can't be a good leader unless you're in a process and a system where you have to learn to follow direction.
Someone says, hey, I'm the boss, I'm a leader.
Well, do you follow well? When someone, and you know, you're a boss, there's always another boss above you.
Somebody told me you got a boss.
when your boss gives you instructions, can you follow the instructions?
That makes you a leader.
That makes you a leader.
You're a smart man. And,
thank you.
And more importantly, you're helping. The reason I say that is because you're helping a lot of young people. So thank you for what you do every day.
Oh, thank you.
All the best. Keep it up. Stay right there. One-on-one from the Newark Museum. We'll be right back right after this. Thank you. Well done.
To see more one-on-one with Steve Adubato programs, visit us online at steveadubato.org. If you would like to express an opinion, email us at info@caucusnj.org. Find us on Facebook at facebook.com/Steve Adubato PhD, and follow us on Twitter at Steve Adubato.
Here in Philadelphia, and we're here at the Healthcare Collaboration Summit put together by the folks at Virtue on Chop, and I don't think we can come together and talk about healthcare without this guy. Dr. Jeffrey Brenner, Medical Director, Urban Health Institute at Cooper University Healthcare, and also Executive Director, Camden Coalition of Healthcare Providers. Jeff, everywhere you go around this country, when you talk to people about how to do it right, and I'm going to put you on the spot right away, they say, Dr. Brenner has it right. Not perfect, but right. What are people talking about in terms of what you and your colleagues do with respect to the delivery of healthcare in urban areas?
I think we've got a mix of data and pretty deep engagement with our healthcare partners, with patients, and a lot of thought about what I call clinical redesign, which
clinical redesign.
Redesign. You can't keep doing things the same way you've always done them and expect different results. So to go back through that, we're a data-rich environment. We have more data than any other community in the country. We use that data every day.
In Camden.
In Camden. To target what we do, to really think hard about what we do, to measure what we do and evaluate what we do. We're also engaging community residents, we're engaging patients in a very deep way, engaging the health systems to really rethink what they do. And then we're moving people's cheese in business terms, right? And change management, ultimately when we're done in 30 years, everything everyone does in healthcare will look completely different.
Dr. Brenner makes reference to moving the cheese. That is a reference to Dr. Spencer Johnson, who moved my cheese. Cheese is a metaphor for anything that's important. Put that in perspective. I believe what you're really saying is the paradigm, the model of healthcare, in this case being a metaphor for cheese, is changing dramatically. Why did the cheese have to move in such a dramatic way?
We are failing in such tremendous ways. So we're in the middle of the largest demographic bubble the world's ever seen. We have 85 million baby boomers. 10,000 people turn 65 every day. And we have the most expensive healthcare system in the world. We spend almost 20% of our economy, $1 in $5 on healthcare. We can't treat this.
That's too much?
It's a staggering sum. We have bridges falling down. We have roads that are unrepaired. We have schools falling apart. Healthcare is gobbling up more and more of our treasure in our country. And as a result, it's crowding out other things. The problem with 85 million baby boomers aging, if we take care of them the same way that we do healthcare now, the system will collapse. We simply don't have enough hospital beds, scanners, and dollars to be able to do the same thing. We're going to have to change how we think about healthcare, the way we deliver services, and what we do.
So people talk about fixing the healthcare system. I know that Dr. Brenner takes a broader view of that because he obviously knows it's more complex. People say, oh, we did the Affordable Care Act. We fixed it. You say?
It's the first step in a long journey here. We're at the earliest days of the steel industry when it got flipped, and that was a 30-year painful journey. Now we do have steel companies in America that do very innovative things, but it was an ugly process. So what we're seeing in New Jersey right now is a complete disruption in the entire hospital marketplace, which is a good thing.
Why is that a good thing?
We, in New Jersey, we have too many school districts, too many police departments, too many hospitals. And we're one of the wealthiest states in the country, and we've never had to make hard decisions. We don't need a hospital every third traffic light.
So here's the thing. This summit is about collaborations. What kind of collaborations could exist okay, there are going to be fewer hospitals because hospitals will close. There'll be more mergers and acquisitions. Okay, fine. But what kind of collaborations could take place that would also potentially reduce the cost of healthcare?
My most exciting collaboration right now is with housing. Housing is the best pill. When we have a patient that we engage who's sitting in Cooper Hospital, who's homeless, our efforts are completely useless until we get that patient into an apartment. So, we have the most expensive homeless shelter in the country, and it's Cooper Hospital. And you get a flat screen TV and a nice bed and room service, and that's crazy. That's not good for the patient. It's not good for society. It's not good for the system. So we're wasting money by medicalizing social problems. We also incarcerate social problems as well.
Hold on. What is housing? I'm thinking about what is housing? Just talking about housing, talking about incarceration. What does that have to do with healthcare?
So we have an 80-year-old lying on a bench in Camden. That's crazy. They get out of the hospital, we spend $10,000 on them, and then they're lying on a bench. What a stupid waste of money.
And so
it cost you $700 a month to put them in an apartment, and then they wouldn't come back to the hospital. So it's in America, we spend a whole lot of money on healthcare services, and we don't spend enough on critical social services.
So if someone's listening to the presidential campaign, and they hear someone say, the first thing I'm going to do when I get elected is I'm going to repeal
Obamacare, you're smiling as I ask the question, you say.
It's crazy. What's Plan B? They have no Plan B. I'd love to hear Plan B. I would love to sit down and genuinely hear what Plan B is. That having people without insurance come to emergency rooms and clog them up is crazy. Having people dying in the streets because they can't take their blood pressure medicine is crazy. It's not a good way to run your economy. It's not a good way to run your country. If you're a business owner and your employees aren't healthy, that's not good for your business. So this was just smart, good policy making. Frankly, the Affordable Care Act was a conservative idea that came out of a conservative think tank, the American Enterprise Institute. So I'm not sure where the disconnect happened, but mandating that people buy insurance and take responsibility is a very conservative idea.
So as we move forward, 2016 and beyond, what responsibility do you feel, Doctor, that patients, that individual citizens who wind up becoming patients, what responsibility do we have in all this, as opposed to saying, quote, they, the politicians, should fix this whole healthcare mess? You say.
It's time for the American public to stand up and say they've had enough. They're tired of sitting in emergency rooms for too long, tired of calling their doctor's office and not getting appointments, tired of doctors running in 10 minutes talking jargon at them. They're tired
What do you mean talking jargon? You're not speaking in a way that they can understand?
Exactly. So, we're not delivering care in a very patient-centered way. If restaurants can deliver good services to you and Disney can figure out how to do that, American healthcare system, we're not getting our money's worth. We're not being treated in a way that's proper. So people leave hospitals overwhelmed, confused. They leave doctors' offices overwhelmed and confused. At some point, the public's going to have to say, we're paying too much for such crappy service.
Let me just follow up one more quick question. In terms of the way we're training future physicians, I've often wondered, should we be training physicians to communicate, to interact, to engage with patients in a more empathetic, compassionate, and frankly, in a way that patients could better understand? And if not, why do we assume they can do that?
Steve, that's such a good question. Right now, the criteria to get into med school is to do great in your science classes. And that's
important.
It's really important, but we can also broaden that criteria. There's a really strong effort all over the country to do that. Our schools in New Jersey are certainly trying to diversify their classes. But another piece of that is working in teams. So the idea of the noble physician leader, with their black bag, come to your home, is just not practical for the complexity that we have in today's healthcare. We're going to have to think about teams and how we restructure healthcare to work in team-based models. Our doctors don't know how to work in teams, so that requires very different training. When they're students, they have to be working with nursing students, public health students, social work students, so they know as kids, when they're in training, how when they grow up and they're in jobs, how to work together.
You're talking more about collaborations. This whole summit in Philadelphia is about collaboration. You're talking about collaboration, right?
Yes, that's exactly right. We've had an interesting experience with this in Camden. We've got 20 communities around the country working in something called student hotspotting.
Student hotspotting.
Hotspotting. So we recruit teams of 5 kids, a med student, nursing student, social work student, public health student. The 5th is sometimes a business student. And they have to pick up 3 to 5 high-cost patients in their own community. We mentor them. We do case conferencing with them. There's a group of kids up in Rochester who found the most expensive patient in the entire city of Rochester. It was a patient who was living in the hospital that had been fired from the local dialysis units who had kidney failure, and all the adults had just given up. And the patient was $2 million worth of cost over about a 6-month period. And the students got involved in the case and got the dialysis to take the patient back in, got the patient housing, really got to know the patient. And don't we want our system to be doing that? If a group of kids had to do that, something's really broken with American healthcare.
Thank you, Doctor.
Thank you.
To see more one-on-one with Steve Adubato programs, visit us online at steveadubato.org. If you would like to express an opinion, email us at info@caucusnj.org. Find us on Facebook at facebook.com/Steve Adubato PhD and follow us on Twitter at Steve Adubato.
We are pleased to be joined by, look at that smiling face. See if he's smiling after the interview. He's Jay Galbraith. He's a teacher at Newark Collegiate Academy. By the way, what is that? It's a charter school, right?
Yes, it is, yeah.
Part of a larger?
Yep, part of KIPP, New Jersey.
Okay, good stuff. You're a science teacher. Mm-hmm. You admit this?
I do admit this, yes.
You're from Chatham, New Jersey.
I am.
And how do we get you in Newark?
So I decided to go after college to do a program called Teach for America, so I could teach for a few years in Newark.
Did Wendy Kopp start that?
That is, yeah, that's Wendy Kopp. Mm-hmm.
Before your time?
Well before my time, yeah, when I was in
Not
elementary
before
school.
mine, yeah, I remember.
Okay. Sorry.
She's great. Okay, so Teach for America.
Yeah, I did Teach for America.
You're only supposed to do a couple of years. What happened?
Yeah, I was going to go to medical school. That was my original plan, and this was going to be sort of a couple years for me to do something else and maybe study for my MCATs. But I started really liking it, and so I decided to stay. And this is now year 7 for me.
Talk about the kinds of things you're doing with these students that are really exciting you and making a difference for these kids.
Well, what we started this year, we started a class called Introduction to Engineering, which we're using for our freshman students, so our new to high school, trying to get them engaged in science and engineering. And one of the big projects we've been successful with is 3D printing.
3D printing?
Yes. And so we've actually just started doing this. We've essentially given the kids some real-world problems and had them create their own solutions using 3D printing, actually creating the devices and getting to test them.
So we're looking at some video right now. Mm-hmm. This is what?
Yeah, so this is the what our student Janaya there, this is the creation phase. So this is her original design on a computer using software called CAD software, computer-aided design. She was actually able to create the device that they wanted to make. And then, of course, once she's done with that, we then send it to the 3D printer and actually build it.
That's fascinating. And these kids are how old?
About 14, 15 years old.
Introduction to engineering? Mm-hmm. And is this brand new for these kids?
For the most part, yeah. They've done maybe small engineering projects, but they've never used, to this extent, used the computer technology and gotten to use this sort of equipment.
So what is it teaching them beyond? Hold on, I want to see what comes out of this.
Yeah, so this right here is actually showing what actually my first example I wanted to show, showing the process of actually building a 3D object.
They're building a 3D object?
Yeah, so this
which is what you're holding in your hand. Wait
exactly.
a minute, I want to see what comes out of this.
Oh, yeah.
Hold on, big reveal. Well, you better show it now.
Yeah. So what we have here, this is a...
That's what came out of that?
That's what came out of that, yeah. So this is a bottle cap holder. So one of the problems we gave to our kids, we were noticing in our school that kids were leaving their plastic bottles all over the place.
I'm sorry, could you come over to my house?
Yes, it's similar
driving me crazy. Go ahead.
Yeah, they're all over the place. It's a huge source of waste and
yes.
A mess for teachers.
Environmental problem.
Exactly, and so we tasked some of the children with the idea of how are you going to keep these bottles with you so you stop losing them. And a lot of kids came up with ideas of kind of big holders, big kind of awkward cases.
Right.
But this group of students actually decided to make something that would hold on to the actual cap. So you can see they built this green part here.
So how do you open it up?
And it actually screws right onto the cap. So you can replace, instead of your normal tape bottle, you screw it right on there. And now you can attach it to a backpack, anything like that.
Hold on. So,
now be gentle. I just super glued it this morning. This was my second version.
So hold on. So you don't need all those tops.
Exactly. Yeah, and this is going to help you keep. You're not going to lose it. You don't need a special holder for it. Yeah.
The advantages of this and the impact it could potentially have on the environment.
Yeah, absolutely. Yeah, I mean, fewer bottles being thrown away or lost, and less waste for teachers to have to deal with.
Now, talk about the impact it has had on your students when they know that they have been involved in creating something like this.
Yeah, I think there's a real magic to having kids involved in an authentic problem. We can give kids a lot of high and mighty science projects, but when you give something really real to students, something really authentic that they can grasp, they get extremely engaged in it. And so when kids understand this problem, and so they love being able to actually solve it and actually do something with it. And that's really the point of the class. It's not necessarily that every kid's going to come out of there loving engineering and mastering 3D printing. It's really that they're coming out of that class understanding problem solving and being excited about the world of technology.
What about teamwork?
Absolutely, and that's a big part of it. They had to get used to the idea that they're working in groups of 3 or 4, and one idea might not work. People might conflict, and that's huge.
You know what else is interesting is, unless I'm wrong about how you're doing this, the economics of this, it's not super expensive.
No, there's an initial upfront cost. So the 3D printers themselves cost about $3,000. We were able to get funding and raise some money to get about 2 of them. But once you start building it, this particular one only costs about 60 cents to produce.
So here's the thing. some of these kids will go into engineering. They will go into science.
Yes.
They will be fascinated by technology.
Hopefully.
And they might otherwise not have any interest because they might not have that opportunity.
And that's big. And I think that, it's common to try to introduce these sort of projects as maybe an extracurricular, something after school for some kids who are already interested. But we wanted every single one of our students to try this out, because I know the hardcore nerds are already going to want to get into 3D printing. I wanted all the kids to realize how interesting this can be.
Is this art?
I think there's an aspect that overlaps with art. There is a creativity and elegance to what they're building, because the kids don't just want to build something that works. They have a real aesthetic eye, and they want to make things that are looking good. And so I think there is a lot of art there, and I think there's possibilities for our art teachers and art classes to use the same technology.
What kind of reaction have you gotten? I'm curious about this, because you went into this as a Teach for America scholar, student, someone who's a pretty special person. What kind of reaction have you gotten from your friends, because they know you're all in now?
A mixed reaction. And I think
seconds left, go ahead.
Oh yeah, it's interesting because, education is so important, and yet when people choose to get involved in education and they turn down careers in medicine or business, it's really surprising to people.
You turned down a lot of money.
I think potentially, yeah, maybe.
Well, what do you mean? You know you are.
Yeah, I mean, teaching is not, you don't teach for the money.
Does that
absolutely.
bother you that you're turning down money?
I don't think so, no, because this job is extremely rewarding, I think.
How rewarding?
Extremely rewarding. I mean, you get to walk away, especially with projects like this, and you realize that kids, you've actually had an impact, and that's...
You know you are.
Mm-hmm. Yeah, I hope so.
They tell you, too.
They don't always tell you. Teenagers don't always express that very clearly, but yeah, I think I am, yeah.
Tell you what, we are so glad that you decided to do what you were doing. We have no idea the impact that you're going to have, you're having, and you continue to have, but a lot of people are proud of you watching you right now. You're a role model. Thank you very much.
Thank you so much.
Well done.
Thank you.
One-on-One with Steve Adubato has been a production of the CAUCUS Educational Corporation, celebrating over 25 years of broadcast excellence. And by the Newark Museum, in cooperation with NJTV and 13 for WNET. Funding for this special edition of One-on-One with Steve Adubato at Newark Museum has been provided by Bank of America, PSE&G, Horizon Blue Cross Blue Shield of New Jersey, the Fidelco Group, Johnson & Johnson, Prudential Financial's Global Communications Department, and by Barnabas Health. Transportation provided by Airbrook Limousine, serving the metropolitan New York, New Jersey area.
Hi, I'm Eric. You might see me as an ordinary person, but I've been living with a brain injury for nearly 2 years. One of my struggles is short-term memory loss. At Opportunity Project, I'm given hope and support, and I've gained my COMIS back through the job placement program. Despite my challenges, I have a reason to keep improving. Today, even though life has changed me, I believe that anything is possible.
If you have a brain injury, you don't have to face your road to recovery alone.